dedicated to Eastern and Southern Kentucky. This is WYMT Mountain News at 11.
Good evening, I'm Steve Hensley. Earlier this month, we brought you a story about Nathan's Law. Senate Bill 66 was recently brought up in Frankfort. It calls for grief training for the state's coroners and came about after a Lexington mother says the way in which she was notified about her son's death was not handled compassionately. After the story aired, it opened up a conversation among other coroners in the state. Amber Philpott sat down with two who serve on the State Coroners Association Board to talk about death notifications and the training already on the books.
It is not a job everyone seeks out, but between these two men, their duties as coroners in their respective counties spans decades. Ferris Markham serves Lincoln County, Jimmy Cornelison, Madison County, and both serve on the state's Coroners Association Board. They know in their job, many times they're delivering the worst news someone will ever receive.
My job is to help the families of our community and get them to understand that, what just happened, we're here for you to help you and support you.
Jimmy Cornelison says how a death notification is made is oftentimes subject to each individual coroner. There's not a standard process.
I couldn't tell you what another coroner does on death notifications. I know what I've always done. I know what I've taught to do to other organizations. And, you just never know on death notifications what the outcome is going to be.
Both Cornelison and Markham reached out after our story aired about Nathan's Law, new legislation proposed in Frankfort that calls for grief training for the state's coroners. The legislation came about after Lexington mother Stacy Burnett's 18-year-old son Nathan was killed in Utah last spring in a snowboarding accident. She says this note was all she was given from a Fayette County deputy coroner with not a lot of other details. She told us the manner in which she was notified was cold and is now calling for grief training for those making these types of notifications.
I've read studies, but I just know from experience how you find out about such a traumatic event kind of shapes your healing process.
Both Markham and Cornelison don't disagree with the call for additional training.
I'm for Nathan's Law. I'm not opposed to it. I think it's a wonderful, wonderful law. I think anytime we as coroners can further our education and make ourselves better, we're doing better for the people we serve.
Well, I definitely don't oppose it, and if there was a problem, is a problem, then we need to correct it.
What these two coroners do disagree with is that there's no training already on the books.
Well, we're mandated by statute to have training, and we have several different trainings throughout the year.
They say as part of their mandated training and free continuing education, all coroners are trained on best practices, and that includes how a death notification is given and the manner in which it should be handled. Does that mean additional training wouldn't hurt? Markham says he welcomes it. As president of the Kentucky Coroners Association, he recently spoke to some new deputy coroners, and there's one thing he says he stresses.
And I told them the hardest thing that they'll ever do in their career is do a death notification. And I told them there's no textbook, there's no you can't Google it. It has to come from your heart.
For Markham, he says he knows many of his fellow coroners and deputies are using compassion when making these notifications. Moving forward, no matter if Nathan's Law is passed, he says there is certainly always room for more discussion on this sensitive topic.
I think moving forward, I think this will be a topic of discussion. I think it may be something that may be heightened a little bit, may be expanded upon. So I think this is something that, we probably need to take a look at a little bit closer.
Both Markham and Cornelison say they always try and have as much information for families as they can and be available for the questions they may have. The coroners spoken to all agree no matter the training, it's up to them individually to make sure that a death notification is handled respectfully, compassionately, and to instill that in their deputies. Senate Bill 66 is now in the House. Kentucky will receive $483 million from nationwide settlements with 4 companies over their roles in the opioid addiction crisis. The money is expected to fund education, treatment, and rehabilitation and help heal communities ravaged by opioids.
There's so many people who have had success with their addiction, and they're now in recovery, leading productive lives. And so it's important that we recognize the potential of these men and women who have had their lives put on hold or really destroyed by this. There is light at the end of the tunnel.
Attorney General Daniel Cameron says settlement money is expected to start flowing to state and local governments in the second quarter of this year.
Well, the weather is pretty calm and cool across the mountains tonight for your Friday. Here is a live look at the London Corbin Airport. We are dry under that mostly cloudy sky, also sitting at freezing at the airport, sitting at 32 degrees. Up on Pinpoint Doppler, all is quiet tonight. We are watching out for those green boxes. Those are our flood warnings after that rain we had this week. Some of those rivers are a little bit high, so please be sure to use caution if you come across those flooded roadways. Be sure to turn around and don't drown. Up on the satellite and radar, watching out for this high pressure over portions of the Midwest. You can see those wind arrows coming in from the north, so our air is coming in from the north. That means we're watching out for some cooler and drier air as we get towards tonight and into your Saturday as well. And speaking of cooler air, check out these temperatures. Many people are at or below freezing tonight. 32 for Pikeville and Prestonsburg, 31 for Jackson and Irvin, 30 degrees over in Moorhead. So definitely chilly tonight. However, with that mostly cloudy sky, those clouds going to act as a blanket. Not really going to fall too much tonight in terms of temperatures. Lows falling off into the upper 20s and lower 30s, and we stay dry under a partly to mostly cloudy sky. Let's walk through the model up on Future View tonight. Not much happening as you wake up on Saturday. We are dry and mostly cloudy, warming up into the middle to upper 40s by Saturday afternoon. And again, not much happening. We stay mostly cloudy and dry. Into Sunday morning, though, early Sunday morning, this is just after midnight, we could see a couple of rain or snow showers, mainly over our southern counties, over those higher elevations. According to this model, we could see a little bit more in the way of snow showers early Sunday morning. We're not expecting much in the way of impacts from this system. We could see a couple of snow showers, mainly a few slick spots on the bridges, but overall, nothing too severe as we go towards your Sunday morning. And by Sunday afternoon, we warm up into the upper 40s and lower 50s under a mostly sunny sky. And speaking of that warm up, check this out. Lower 50s on Sunday and Monday. How about upper 50s as we get towards the middle of the work week, maybe even lower 60s by Tuesday and Wednesday. Up on that 7-day forecast where the weekend is always in view, mostly dry and cloudy tomorrow, highs in the middle to upper 40s, lower 50s on Sunday. We could see a couple of rain or snow showers towards the morning hours. Again, not looking to be a huge deal. Just use caution if you have to be out on the roads. Lower 50s under a mostly sunny sky on Tuesday, upper 50s to near 60. And check out that warm up, Steve, middle 60s as we get towards next Friday.
Definitely looking better. Cameron, thank you very much. I haven't had much sleep today. Well, we are seeing less positive COVID cases here in the Commonwealth, but an Eastern Kentucky doctor says our region is not out of the woods yet. Dr. Ferris Cotter says he's still seeing plenty of positive COVID patients, but the good news is hospitals are not overcrowded.
And we're still seeing a lot of COVID-19 cases. However, our hospital numbers are down. We're down to 157 patients in the ARH system as a whole, compared to 200 some a week or 2 weeks ago.
Dr. Cotter says if you are at high risk, you should continue wearing your mask, especially indoors. The CDC said today that most Americans live in places where healthy people can safely take a break from wearing masks. Well, here's a look at Kentucky's latest COVID numbers. Kentucky added 2,202 new cases today, bringing our state total to more than 1,274,000. Kentucky also added 38 new deaths, increasing the total to 13,758. The positivity rate is now just below 10%. Haven't seen that in a while. But unlike other parts of the state, all eastern Kentucky counties are still in the red, meaning a high incidence rate. Russian troops are bearing down on Ukraine's capital with explosions and gunfire heard in the city. The invasion has fueled fears of a wider war in Europe and triggered international efforts to make Russia stop. The president of Ukraine appealed for a ceasefire and warned in a bleak statement that multiple cities were under attack. There are growing signs that Vladimir Putin may be seeking to overthrow Ukraine's government. Meanwhile, the U.S. and other global powers slapped tougher sanctions on Russia. UN officials say they are preparing for millions to leave Ukraine. With so much going on in Europe and here at home, it's easy for headline anxiety to creep up and make us feel stressed and overwhelmed. We are sharing 3 tips health experts recommend for you to follow to help reduce any heightened anxiety. Number 1, you can use your senses and sniff your way to serenity. You can do that by lighting up a candle or using essential oils. Number 2, pause and sip on something warm, like hot tea.
Now, why hot tea? Well, when something is hot, we have to slow down. We have to calm down in order to slowly drink the hot beverage.
Lastly, you might try a breathing technique. Hold at the top for 4 counts and slowly breathe out for another 4 counts. To help combat heart disease in Harlan County, ARH was awarded a $100,000 grant today given by AFLAC as part of their Close the Gap initiative. Hospital officials say they plan to purchase new equipment with the grant. AFLAC U.S. President Teresa White says they want to keep this partnership with ARH going for a long time.
We are always going to be here in the community, and what we want to do is we'll be following along with Dr. Damas and ARH to understand how they're utilizing the funds.
A new AFLAC Park bench was also unveiled today. You can find that at the Dressen Park. In response to the ongoing healthcare worker shortage, SOAR hosted the Healthcare Career Pathway Fair at the Appalachian Wireless Arena in Pikeville today. This event brought in more than 700 high school students and staff from the Big Sandy region to learn more about the healthcare career opportunities. Those involved say this event not only showcases potential careers for students once they graduate, but it also shows what's available in their own backyards.
They're the future workforce, they're the future of this region. Today specifically is about healthcare, and healthcare is the #1 industry in the region, and there's tons of opportunities that are available in this field via nurses and a ton of other support roles.
Today's career fair offered students the chance to watch a live emergency room simulation and even practice performing ultrasounds. They say they are thankful for the help of SOAR's hospital partners and the other organizations that made this event possible. Well, thank you for joining us tonight, but don't go anywhere. John Lowe will have district tournament highlights from around the mountains as 8 more champions were crowned this evening. The Appalachian Wireless Sports Overtime is next. Have a good night and a great weekend.